Eyelid surgery. So many patients come in and they say, Dr. Truesdale, I'm just looking tired. Very often, patients are looking tired because of the upper third of the face or the eye area. The combination of the brow and the eyelid skin and the fat around the eye, as well as the coloration of this area, adds to signs of aging. As we age, our brows fall, our eyelids lose fat and volume around the brow. Inside, the fat starts to kind of herniate out the lower lid, the fat pooches out. So the whole idea of rejuvenating the eye area is putting it back to where it was. Very often that requires lifting the brow to some extent, as well as removing the extra crepey skin of the upper eyelid. That's called an upper blepharoplasty. Some patients also require removing a little bit of fat from their upper lid as well to help smooth the contour. Now, lower eyelid surgery or lower blepharoplasty can also be performed. What that involves is sometimes making an incision in the skin, but very often I get around this by actually approaching that fat that's pooching out by making an incision inside the lid so no scars are made. What I then do is I find that fat that's bulging out. It can be trimmed if needed, but very often I like to preserve this fat and I slide it into the nice hollow, the groove that you have under your eyelid. This does two things. It takes care of the bulging and it also takes care of the part that's too hollowed. So it softens that transition. Sutures are kept in place to take that fat and keep it down in place for about 5 days. You can expect bruising and swelling for about a week to 2. And patients generally look amazing after eyelid surgery. Upper blepharoplasty is very often performed under local anesthesia, whereas the lower eyelid surgery usually requires a touch of sedation just to keep the patient nice and comfortable. So if you are interested in eyelid surgery or are bothered by signs of aging, come and see me and I'm happy to discuss any surgical or non-surgical options with you.